In the US today, more than 16% of Americans cannot pay for their health care. Each year, the price of basic medical procedures rises, only putting more Americans into poverty. Hospitals and private companies have decided to choose their revenue over the well-being of their patients and customers. If this continues, then that 16% could rise to dangerously high numbers. Hi, I'm Jackson O'Brien, and I will be talking about healthcare in the US. For years in the United States, we have been paying way too much for healthcare. Although some of us can pay off these medical bills with ease, a very large portion of our population cannot, and actually many even fall into poverty because of it. Over the past years, healthcare prices have been raised and making it much harder for people to pay for it. Now we have collected data as evidence to show how much more we pay for healthcare and how our government can help the 16% of our population pay for their healthcare. This graph here shows the average price for categories of healthcare for the US compared to 5 other OECD countries. This graph shows each category of healthcare with the price of the service and a percentage, only in the US column, that shows how much more we pay compared to the average of the other 5 OECD countries. The US is the farthest column on the right here, while the 5 other countries are these smaller columns. As shown, the average American will have to pay at least 236% more for just an ambulance to get to the hospital. It also shows that you have to pay 168% more just for going to the hospital after getting that ambulance ride. Now we're going to bring in our expert, Jack A. Bryan. Hi, I'm Jack A. Bryan, and I'm an expert on the healthcare industry.
What is a way our government can provide a healthcare aid plan?
A way for our government to help those who have less money to pay for healthcare is to follow an example set by Parkland Hospital in Dallas, Texas. Parkland offers a program to people who cannot afford the medically necessary service or they do not qualify for a different funding source. The US government should follow this example and create a program that is similar to Parkland's. They should pay for the necessary medical service or cover a significant portion of the service. This would help lower the number of Americans that fall into poverty because of healthcare and would also let people who cannot afford the medical service have access to them.
How will this government program help people?
Well, our next data point is that almost a quarter of Americans will skip medical visits because they cannot pay for them. This leads to a much higher death rate due to the fact that people will not get treated for their illnesses only because they cannot pay for it. A government program that helps to cover those who cannot pay for the healthcare would not only help these people make it to their medical appointments, but also lead to a healthier population and lower mortality rate in impoverished areas.
What is another thing that leads to increased prices in healthcare?
Medical malpractice has also taken a toll on those who cannot easily pay their medical bills. At times, some doctors will prescribe unnecessary medication or procedures such as an MRI or prescribing for painkillers to increase their revenue. This leads to more Americans paying way too much for their health care and will cause them to go into poverty. A government health care plan could help these people who are taken advantage of and let these people be able to live and not have to worry about when the next payment on their medical bill will be.
What does this healthcare graph show us?
In this graph, it shows us the comparison between the prices of insulin medication in the US versus the worldwide average prices of the same medication. As shown in the graph, the US will pay almost $70 more for the same medication. The US is represented by a blue column, and the worldwide average is represented by an orange column. As you can see, the blue columns are much larger than the orange columns. This is a major problem because it causes many people to overpay for a medication that they need to survive, and it causes some to die because of the high prices since they cannot buy the needed drugs. In the US, we pay too much for basic health care and for medications that some need to survive. Medical malpractice causes people to have to pay for unnecessary procedures and has caused people to fall into poverty because of this. The government can implement a program to help lower the cost of necessary health care or even completely cover necessary health care costs for those who have financial problems. Parkland is a great example of how this program can be put into action and have demonstrated that this works very well. A healthcare system that helps our population is the best type of healthcare system that we can have. Thank you, Jack A. Bryan, for speaking. Healthcare has been a common problem for people here in the U.S., especially now because of COVID-19. People have been unemployed and cannot afford healthcare. We must change our hospitals and our government to either lower the overall cost of healthcare or cover anyone who cannot pay their medical bills. If we do not, then more and more Americans will be unable to afford basic healthcare.